These are the ones
Recording
that
in
are loading for me.
progress.
All right, so let's start with number 1, and we'll kind of do our little recap of articulation. So what is the least mobile type of joint for number 1? Perfect. So everybody said suture, so that would be right. So remember that the suture is found in the skull, right? So that's going to be your least mobile type of joint. Very good. All right, so out of the number 2, which of these does not belong? Is it fibrous, cartilaginous, symphysis, or synovial? Good, right? It's symphysis because we know that there are 3 categories of joint. There's fibrous joints, which have the 3 types, cartilaginous that have 2, and then synovial that just has 1, which is synovial. All right, so for question 3, which is not a type of fibrous joint? So remember those 3 types, and then what are they? So which of those is not one? So if we're looking at those, which of those would not be a type of fibrous joint, right? So somebody put E, none of the above, which would be right. And the reason that that's correct is because the fibrous joints, there are 3 examples, right? The first one is suture, found in the skull. The second one is gomphosis, found in your gums. And then the third type of fibrous joint is called syndesmosis or interosseous. So it actually has 2 names. So we're going to choose E or none of the above because all of those would actually be true. So when all of the answer choices are true, you choose none because it's kind of like saying, well, all of those would be correct. So I'm going to choose none because I'm seeing that all of those answers are true. Does that make sense? So none of those would be correct to choose as not a type. So for question 4, which of the following is an example of a synchondritic joint? So remember your definition of synchondritic is a joint that does not move, right? Syn meaning no movement. So which of those is an example of a synchondritic joint? Good. So a few people put down C, answering for suture. So that would be correct. So suture is a synchondritic joint. It's a joint that does not move at all. Versus D, costochondral is an example of a syn. I see. Synchondritic. Sorry, I misread the question as well. So synarthritic versus synchondritic is actually a really easy way to get confused. I actually just read the question too, and I was thinking it was saying synarthritic. So remember, if it says synarthritic, that's talking about the joint. So we have diarthritic, which is freely movable, amphiarthritic, which is moves a little bit, and synarthritic. A synchondritic joint is different. So a synchondritic is an example of a cartilaginous joint. So the cartilaginous joint, if you guys have your notes next to you and you have the outline, that would be really good to look at kind of while we go over this. So if you're looking at that outline on the cartilaginous section, there's two types of cartilaginous, right? There's our synchondritic cartilaginous joint, and then our second example is symphysis. So a synchondritic joint is a type of cartilaginous. Does that make sense? Versus synarthritic is a type of movement. So if we look at it that way, synchondritic joint is the costochondral joint. Suture is an example of a synarthritic joint. Hopefully that kind of made sense. Sorry, I didn't mean to confuse you, but hopefully that made sense when I differentiated it. Synarthritic would be type of movement. Suture does not move at all. Synchondritic is a type of joint. Costochondral is an example. Number 5, intervertebral disc is an example of what type of joint? All right, so let's all answer question 4. Which of the following is an example of a synchondritic joint? Oh, sorry, 5. Intervertebral disc is an example of what type? So if you said amphiarthritic, that would be right. So remember that an amphiarthritic joint just moves a little tiny bit. An intervertebral disc is a symphysis joint, right? And an intervertebral disc moves just a tiny bit to absorb some of the impact when you walk. Question number 6. Which of the following is not part of a synovial joint? For question number 6. So is it fibrous membrane, synovial fluid, articular cartilage, or interosseous membrane? Yes, so you're all saying D, right? So D, because the interosseous membrane is like kind of fictional. It's not something that's found inside the joint. We remember we have our fibrous membrane that goes around the joint. There's also the serous membrane that puts out the synovial membrane that puts out the synovial fluid. And then we have the articular cartilage found at the ends of the joints, right? All right, for question 7, what is the inside layer of the articular capsule? So the inside layer of the articular capsule, a few people said C, right? So C for synovial membrane. That would be our outside is our fibrous, and then our inside is our synovial membrane, and that puts out the synovial fluid, right? What is the purpose of synovial fluid? Synovial fluid is used for what? B, right? That one was pretty easy. Synovial fluid is used for lubrication of the joint. All right, number 9, the condition when synovial fluid crystallizes inside of a bursa is called what? Good. bursitis, right? Bursitis is exactly that definition, when the synovial fluid crystallizes inside the bursa. All right, question 10. What type of cartilage is articular cartilage composed of? Good. So it's going to be composed of our hyaline cartilage. And then a bonus question for you guys. What would the condition be called if articular cartilage wears down? What would that condition be called? It's going to be called arthritis. Good, good. Yeah, arthritis causes those bones to deform. All right, so 11, the space where synovial fluid can be found is which of these? So the space where that synovial fluid can be found in the joint. Rheumatoid arthritis, I believe, affects the, I believe rheumatoid arthritis comes from crystallizations in the synovial fluid, but I'm not 100% sure on that. That would be a really good one to ask your teacher or to research, but I don't really know the answer to that. Okay, so for the space, we're looking at joint cavity, right? The joint cavity is that space in the joint where the synovial fluid is found. And then what is an elongated bursa? What is that called? Good, you guys are fast. So elongated bursa is called a tendon sheath. And then the last one here, a joint that has two planes of motion. What would that be? Our biaxial joint, right? Good. You guys have access to the answers as well, right here in the same Google Doc link. I'm going to see if I can get these to load. If I have. Can you guys all still see my app that I just opened? I think that's the way this works. So you can see my screen, right? I think so, because it might work better if I go to the thing on the app, and then maybe it'll cooperate with me. Everybody can, oh, sorry, wait, you're probably writing something in the chat and I don't see it. Let's see. Are you guys, can you see my app now?
Yeah, we could see it.
Okay, perfect. Thank you. Okay, so for these practice questions, I also have some practice questions here that I wrote a previous semester. And then, like I said, I'll share with you guys the practice questions that I wrote this semester. I'll post them. I will post them. Why did this decide to do this on me? I'll post them in a announcement. I don't know why. This is not the day for my technology. Literally everything is not cooperating. Okay, here we go. So if a bone cell were catabolizing hydroxyapatite or matrix using phagocytosis, what would that bone cell be? Good. Everybody's saying osteoclast, right? Because the osteoclast catabolizes matrix. All right, what about number 2? What layer do perforating fibers attach to? So if for perforating fibers attaching, right, we're thinking about those anchoring for tendons and muscles. And we know that the muscle becomes a tendon, right? And then that tendon attaches through a perforating fiber into the hydroxyapatite. And what they actually use is the periosteum, right? So the periosteum is kind of this coating around the bone. And then in order to get to the hydroxyapatite, the perforating fibers attach through the periosteum, if that makes sense. Ligaments would attach bone to bone. For number 3, which of these is not a type of lamellae? A, right? Circumstantial, right? Because we know that interstitial is the rest of the lamellae that are not the circumferential or the concentric. Concentric lamellae are the ones that make up the osteon. Circumferential go around the entire bone, and then interstitial would be all the spaces in between. Okay, let me go to a different one because I kind of want to stay on cartilage and bone for right now. So let's go to these ones here. Right, so we already did some joint stuff. So let's go to tendons. Question 10. Tendons do which of those? Do they attach to the periosteum, hold bone to bone, help to detect pain, made of dense regular, or none? Right, so the answer would be, let's see what you guys are saying. So the answer would be for tendons, tendons are going to be made of dense regular connective tissue. Remember, dense regular makes up tendons and ligaments, right? So some of you, I think, were putting A attached to periosteum. And the reason that that's actually not correct is because remember we said that tendons attach to perforating fibers that attach to periosteum. So the answer there should be D, made of dense regular. All right, so 11, a pivot joint. So which of those is a pivot joint? C, right? So a pivot joint is an atlantoaxial. I gave that to you guys when we were going over the joints in SI. Remember that that's the joint at the top of your neck that helps your head to pivot back and forth. So the atlantoaxial joint is your example of a pivot joint. The metacarpophalangeal joint is your example of a condylar joint. Okay, so on the test, metacarpophalangeal joint would be a condylar joint. Okay, atlantoaxial would be your pivot joint. This carpals and tarsals would be your gliding joint. Skeletal system is composed of which of these? Bone, cartilage, ligaments, other support tissue, or none? None, right? Because all of those would be true. bone, cartilage, ligaments, and other support tissue are all part of the skeletal. All right, so for 13, cartilage is not which of these? D, right? Because cartilage is, it is true that cartilage is avascular. It is true that cartilage is made of chondrocytes and chondroblasts. And we know that it would not be true that it's made of hydroxyapatite. All right, question 14. Cartilage does not function for which of these? So the answer here would be C, right? Because bones help with movement, but cartilage makes movement less painful, but technically cartilage isn't something that makes you able to move. Does that make sense? If you have arthritis, it's really, a person with arthritis does not have cartilage, or they've lost most of it. And it's really painful for them to move, but they can still move. It's not the cartilage that makes them move. Does that make sense? Bones and muscle make you move. All right, question 15. Appositional growth in cartilage is all of these except what? Right, so we see that the cartilage does function for the support of soft tissues. It does function as a gliding surface at articulations. It does function as a precursor model of bone growth. Oh, sorry, we were on 15. Oh, no, okay. 15, we know that the answer there would be D, because appositional growth in cartilage happens on the outside. So interstitial growth in cartilage is on the inside with the newest stem cell mitosis of the chondroblast to chondrocyte, which is the process we went over, right? That process happens in interstitial at the internal matrix. If it's appositional, it's happening at the perichondrium. So appositional growth in cartilage happens at the perichondrium or the outer limit. The interstitial is at the internal matrix at the inside. All right, so 16, appositional and interstitial growth in cartilage are distinguished by which of these? Right, so we know that for appositional and interstitial growth, they both involve two chondroblasts in one lacuna, and that leads to the separation of chondrocytes. The process of growth for both is the same. What's different is the pattern, which means where they grow. So the pattern or the location of growth. Again, appositional is on that perichondrium or the outside. Interstitial is in the internal matrix or on the inside. All right, question 17. As a system, bone involves which tissue types? Good. So I see people putting E, so that would be correct because bone involves all of those tissue types. So none of the options we see there are correct. So we're going to choose none, right? Because all of those are true. So we need to choose none because we're assuming all is part of the other options, basically. Bone does not store, for question 18, bone does not store which of these? Phosphorus, chloride, fat, calcium, or none? So we know that bone does store calcium phosphate, right? Calcium hydroxide, and we know that bone also stores fat. So I would agree with you guys putting B, chloride, that chloride would be the one that we don't learn as bone storing. So I agree that chloride would be the correct answer to that question because it's the one that bone does not store. All right, for question 19, short bones are which of these? Vertebrae, tarsal, phalanges, ethmoid, or none? Oh, sorry. I was trying to see the chat and then I stopped sharing. Wait, can anybody see anything yet? No, wait. Start broadcast, 3, 2, 1. And then we're gonna go. Okay, can you guys see that? Yes, okay, I think you can see the canvas because I see a recording thing. Okay, so we were on question 19. So the answer to question 19 would be the tarsal bones because the tarsal bones are the ones that are in your feet. Carpals are in your hand. And those are an example of a short bone because they're very like square in shape and they're very short, right? Long bones would be like your femur, your tibia, your fibula, etc. All right, question 20, the epiphysis. What is true about the epiphysis? Does it have articular cartilage, yellow bone marrow, endosteum, the epiphyseal plate, or none? So for the epiphysis, right, we know that the epiphysis does not, I'm just going to start with the ones we know for sure it does not have. It does not have yellow bone marrow, right? Because the yellow bone marrow is in the diaphysis. The endosteum goes around the medullary cavity, and the medullary cavity is a part of the diaphysis. The articular cartilage is actually found at the end of the epiphysis. So it could be A. D also looks right? Because we're like, oh, it has the epiphyseal plate, and the epiphyseal plate sounds like epiphysis, so it's got to be D. Well, the epiphyseal plate is actually found in the metaphysis. So the metaphysis, which is where the epiphysis and the diaphysis meet, that little meeting point, metaphysis, is actually the location of the epiphyseal plate, which will eventually ossify into the epiphyseal line. So for this question, articular cartilage A would be the correct answer because that's what's found at the edge or the end of the epiphysis. D would be true for metaphysis. Does that make sense? All right, for question 21, periosteum, which of these is true about the periosteum? Right, so it is made of dense irregular connective tissue, right? So we know that the dense regular is making up our tendons and our ligaments. Osteocytes would be found in our lacunas in our osteon, not at the periosteum. They would be deeper in the hydroxyapatite of the bone. And then the ligaments attached to bone, right? Not to the periosteum. So we know periosteum is made of dense irregular. Endosteum is also made of dense irregular. So periosteum covers the bone. Endosteum covers the medullary cavity. Both of those are made of dense irregular connective tissue. Question 22, osteoclasts. So which of these would be true about osteoclasts? C, right? So osteoclasts are going to phagocytize or break down the matrix. And as they break down that matrix, they're going to be releasing calcium into the blood. Good. Question 23, hydroxyapatite. Which of these would not be correct? So hydroxyapatite is not the matrix of bone. It's not inorganic components. It's not calcium phosphate. It's not organic components. No, that's not what it's saying. It's saying not true. I don't know why I didn't put true. Just pretend not true is on there. And then that will make it more clear. Which of those is not true? So we know that it's made of inorganic components. We know that it composes the matrix of bone, and it's made of calcium phosphate and calcium hydroxide. So yes, D would be the correct option because D is not true. Good job. Sorry about the missing the word there. Should say not true. 24. Which of these is not true about spongy bone? So is it A has trabecula, B hemopoiesis, C has osteons, or D does not have osteons? C, right? C does not, where's my question go? Does not have osteons is the one that's correct there. I mean, has osteons, right? Because we know that the spongy bone does not have osteons. The spongy bone performs hemopoiesis, and the spongy bone has trabeculae. So when we answer this, C would be correct because it does not have osteons. All right, so I'm thinking of doing some cardio heart questions, if that sounds good to you guys. We'll keep going through some of the cardio questions we have built in here. So I'm gonna go back to these ones, and then we'll just kind of swap back and forth. So let's go to question 4. Can you guys tell me really quick, when I go and look at the Zoom chat box, can you still see the Canvas page? Or am I sharing the fact that I'm looking at the Zoom chat box and you guys can't see the question? So like right now, can you see Zoom? So right now you see Zoom. Okay. So I'll just try to do it really quickly because I'm trying to see what you guys are saying, but I'll try to go fast so that I don't like disrupt you guys too much. Okay, so for question 4, the fluid that pulls away heat and reduces friction is found internal to which layer? So question 4. So first think of what that fluid is, and then you can think of where it is, and then the location is how I would do that question. So if a fluid is found internal, it means it's closer to the heart. So if you think about it, the serous fluid, right, that floats in between the pericardial, 2 layers, the pericardial sac, right? So we have the fibrous layer and the visceral layer. The fluid floats in between. So technically the answer here should be fibrous layer, because the fluid is internal to the fibrous layer. Internal to the visceral layer is the epicardium, and there is no fluid in between the visceral layer and the epicardium. They stick to each other. So the correct answer here should be fibrous layer. So our answer should be E, none of these, because we're looking for it to be internal or closer to the heart, right? The fluid is closer to the heart, internal to the fibrous layer. That makes sense because it floats in between the fibrous and the visceral around the heart. So the fluid would be internal to the fibrous layer. Question 5, what motivates the tricuspid valve to close? Okay, so I think I have a few different answers there. So remember that the tricuspid valve is going to close in the right ventricle, between the right atria and the right ventricle. It's going to close because of pressure, right? So when the blood fills that right atria and the blood flows down into the right ventricle, as the right ventricle fills with blood, it's going to get behind the valve, the tricuspid valve, and cause it to shut. There is no consequence to the Purkinje fibers traveling up the myocardium. That's not something that would cause it to close, and neither would the semilunar valves closing. Or I can't remember exactly what people's answers were in the chat, but E would be correct because the pressure of blood would be the correct answer. Does that make sense? That would be what motivates the tricuspid valve to close, would be the pressure of blood filling the right ventricle. What is the purpose of trabeculae in the heart for question 6? Good. So trabeculae help with the accommodation of blood. They line the ventricles, and their purpose, again, is to help with the accommodation of blood. Very good. All right, so question 7. When blood flows out of the left ventricle, what is the very first structure it meets up with? So you're just gonna think about your blood flow there, right? And hopefully you all said C, right? So C, our first structure that flows out of that left ventricle would be our aortic semilunar valve, and then it gets into our ascending aorta. And then we know that our first branch off that ascending aorta is our coronary arteries, right? Good job, guys. All right, so question 8, when blood returns to the left atria, it returns through which vessels? Good. So we're all saying veins, right? Veins always bring blood back to the heart. All right, question number 9. The blood that enters the right ventricle originated from where? Where does that blood originate from that enters the right ventricle? Good. E, because all of those would be true. We know that the superior vena cava, inferior vena cava, a zygous vein, and coronary sinus all bring black blood to the right atria. And then we know that the right atria flows blood to the right ventricle. So if that's the case, they must all be bringing the blood into the right ventricle, and that blood from the right ventricle is pumping that out, right? So we know that we would choose E because all of those are bringing that blood into the right atria, which then trickles down into the right ventricle. Okay, for question 10, when blood circulates to peripheral tissues, body tissues, organs, skin, and muscle, which chamber of the heart is that blood coming from? Good, left ventricle, right? Because the left ventricle pumps that blood out to the body. Yes, good. So that would be D, left ventricle. All right, question 11. Which is not true of the gomphosis joint? So this is a little bit of a transition back to joints, and then we have a little more on heart in a second. All right, so we know that the gomphosis joint, you can think G for gums, right? Gomphosis gums. It is linked to the gums in the mandible. That would be correct. It is synarthritic. You don't want your teeth wiggling around in your mouth, right? But all of the fibrous joints are made of dense regular connective tissue. So none of the fibrous joints that you guys are going to see that you guys study, the gomphosis, the suture, the syndesmosis, and the interosseous, none of those fibrous joints are made of dense irregular. They are all, for the test, made of dense regular. All fibrous joints are dense regular. So we know that the gomphosis joint would not be made of dense irregular. So that would be C. 12. Cartilaginous joints are not which of these? D, right? We know that cartilaginous joints are found in the intercostals at our synchondritic joint, found in the growth plate, again at our synchondritic joint. We know they're synchondritic. They don't, they're part of that synchondritic category. They're also synarthritic and they don't move. And then we know that D would be not true. They are not made of elastic cartilage. They're made of fibrocartilage for the symphysis joint, and then hyaline cartilage for the synchondritic joint. All right, back to heart. 13. A patient with a partial prolapse has lost function to which heart structure? All right, so if you said none of these, that would be correct because we know that prolapse comes from chordae tendineae breaking. So in a patient with a partial prolapse, one of the chordae tendineae has broken, and that's why they have that partial prolapse. Again, a chordae tendineae broke. So we don't see chordae tendineae there. So we're going to choose E, none of these. Question 14, the dub sound of the heartbeat is caused by what? So we know the dub sound is going to be caused by the semilunar valves closing. The lub sound is caused by the atrioventricular valves closing. So D would be the correct option, right? D as in dog. The semilunar valves closing off would be the sound, the dub sound. Question 15. Blood leaving the heart and going to the lungs will go into the pulmonary trunk, which branches into what? If you said pulmonary arteries, that would be correct. Pulmonary arteries, we know that arteries always go away from the heart, veins always come back to the heart. All right, question 16. The pulmonary circuit ends in which chamber? If you said it ends in the left atria, that would be correct. The pulmonary circuit starts in the right ventricle as it goes to the lungs and then ends in the left atria when it comes back to the heart. Question 17. Infants do not oxygenate their own blood. Which heart structure is essential to their mother oxygenating their blood for them? If you said D, ductus arteriosus, that would be correct. Remember that it's called ductus arteriosus in infants, and then it's called ligamentum arteriosum in adults. Okay, ductus arteriosus in infants, ligamentum arteriosum in adults. All right, question 18. The tunica media is not found in which of these vessels? So remember, we have our 3 layers that go around major arteries and veins, right? If it's a artery or a vein, arteriole or a venule, it's going to have 3 layers: the tunica externa, tunica media, and tunica interna. We know that the capillary bed just has the tunica interna. So the answer here would be B, capillary bed, because that has only the tunica interna and does not have any other layer. Question 19. The process of transitioning a continuous capillary to a fenestrated one is called what? If you said diapedesis, that would be correct. Diapedesis is that process. We know that basophils release histamine. Histamine causes diapedesis, which is when the continuous capillary changes to a fenestrated capillary and causes those white blood cells to move out of the gaps, right, to help with infection. 20. When blood returns to the heart, it uses muscle movement along with which of these to help move it? If you said valves, valves is correct. Valves is how the blood gets back to the heart on the venous side. Question 21, true or false? Increasing blood volume increases the blood pressure. True or false? You guys said true, that would be correct. We can increase someone's blood volume. We can give them extra water, and that can increase their blood pressure. That doesn't mean that if you go drink water, you're going to have a higher blood pressure. It means that if you overhydrate someone, like, you know, when people are at a hospital, we're giving them IV fluids. If we accidentally give somebody, let's say we hang 3 liters, and we were supposed to hang 300 milliliters, we're going to then increase their blood pressure if we get that drastic of a jump. It's more helpful for patients who have like hypovolemic shock, and then you can give them an infusion of fluids. All right, 22, during the PQRST wave, when are the atria repolarizing? So during the P wave, those atria are depolarizing or contracting. During the QRS complex, the ventricles depolarize or contract. During the T wave, the ventricles repolarize or refill. The atria repolarize or refill during B, the QRS complex. In this class, you guys don't learn about a U wave. Okay, so we don't, that's something that you'll cover in nursing school, but you don't learn about the U wave now. 23, repolarization references what in the heart? Refilling, right? So we know that A would be correct. Repolarization references refilling. 24, the presence of prothrombin in plasma means that which is not true? So this is kind of a tricky one. We know that prothrombin is a protein always found in the blood. And we know that plasma is made up of protein and water. So A and B are not true because plasma is protein and water. Plasma is protein, water, and other substances. So A, B, and C are not the correct choices. Serum is plasma minus clotting factors, and prothrombin is a clotting factor. So if serum is plasma minus clotting factors, then prothrombin cannot be present when there's serum. So if there's serum, we don't have prothrombin. Does that make sense? Serum is plasma without clotting factors, which is prothrombin and fibrinogen. Prothrombin and fibrinogen. Okay, so the answer there would be D. Question 25. Heparin is successful in blocking the clotting process of blood because it blocks the release of what? So if you said E, none of these, you would be correct. Heparin blocks the release of factor X, right? Question 26, looks like I left some of it there. When hemoglobin gets broken down by the liver, which subcomponent makes up bile? So I think that I already maybe gave you guys the answer there. This is from when I had done it in SI. So our answer would be A, because bile is made of phospholipids and globin. Bilirubin is made from the iron or heme. Okay, so I kind of already answered that one there. All right, 27. A patient with acidosis has a blood pH of which of these? Remember, your range for pH is 7.35 to 7.45. So a patient with acidosis has a blood pH of which? If you said D, that would be correct. So 7.35 to 7.45 is your range. If a patient, we were just talking about this today, if a patient's blood got to 6.9, they would be dead. So the range is really small. Your body doesn't have a big range. 7.35 to 7.45. If you're 7.34, you're acidosis. If you're 46, you're alkalosis. Okay, so 7.44 and 7.44 would be within the range, 7.36 within the range. Again, 7.35 to 7.45 exactly is the range. 28, in the respiratory system, after air encounters the nares, where is the next place it will go? If you said the nasopharynx, that would be right. So the air goes in through the nares and then back into the nasopharynx. And then it would go through the oropharynx and the laryngopharynx. Question 29, the sinuses are all of these except if you said C, sigmoidal, that would be correct. Remember, we have the maxillary, ethmoidal, sphenoidal, right? Maxillary, ethmoidal, sphenoidal, and then our sigmoidal, that would not be a sinus. All right, so last one, 30. The lacrimal canal drains into which of these? If you said B, nasopharynx, that would be right. That's why we all get that sniffly nose when we've been crying a lot. All right, so let's do a few more on this one, and then I'll let you guys go at 6:15. And if you guys have questions about anything, please stay. I'm here until 6:45 today. So please don't just leave when it's 6:15. I'm just going to end it early. That way people have some room for questions if you guys have any. So let's kind of do a few on digestive. Looks like we have about 10 on digestive. And then at that point, we'll end at about 6:15, okay? So for question 32, when food comes from the intestines and passes through the liver, it travels through which vessel? All right, so if you said E, none, you would be correct. And the reason is the correct answer is the hepatic portal vein. If you thought, well, why isn't intestinal right? It's literally saying intestines. These splenic, mesenteric, intestinal, and renal, those are all offshoots of the descending aorta. So the descending aorta has arteries that supply different organs. The food that comes from the intestines and passes through the liver is actually a vein. So it goes through the hepatic portal vein. Question 33, when food passes through the liver, what happens to it? So what happens to food in the liver? anabolism, right? The liver builds back up those nutrients, those little digested particles that were coming from the intestines. All right, 34. The vascular layer of the intestine is called which of these? So if you said E, that would be correct. So the vascular layer is the submucosa. Remember, we have the serosa or adventitia on the outside of the intestine. Muscularis is the smooth muscle layer. Mucosa lines the intestine. And then our submucosa is the vascular layer. 35, the teeth that help with ripping and tearing. The teeth that help with ripping and tearing are which of these teeth? So remember to go through your guys's functions of the teeth. You'll get, I think it's 2 or 3 questions on the test on the functions of the teeth. So for this one, the answer is B, the canine's function for ripping and tearing. Question 36, the lower esophageal sphincter connects the esophagus to the what? So it's the first part of the stomach, right? So which of those is the first part of the stomach? If you chose cardia, cardia is right. The other name for the lower esophageal sphincter is the cardiac sphincter. The body is the main portion of the stomach. The pylorus is the last portion that leaves the stomach. And the fundus is the portion of the stomach above basically where the lower esophageal comes in. Question 37, absorption does not occur in which of these? If you said A, stomach, that would be correct. The ileum if you said C, duodenum, that would be correct. Remember that the duodenum or duodenum is the first part of the small intestine, and the duodenum does not perform any absorption. It is the site for chemical digestion or the breakdown of food. There is a tiny bit of absorption that does happen in the stomach. So C, duodenum would be the correct answer. Absorption does not occur in the duodenum. Question 38, the kidneys are located where? Inside the peritoneum, inside the gastric ligamentous, within the Rugae folds, or retroperitoneal, or none? If you said retroperitoneal, that would be correct. Remember that the kidneys are the only organ in the abdominal area that's not located inside of the peritoneum. They're located retro or behind the peritoneum in your lower back. So that would be correct. D would be correct. 39, the first enzyme to help digest carbohydrates is which of these? So it's the very first one. So if you said none, none would be correct. Okay, so the enzyme is called salivary amylase. It's found in the mouths of adults. Lingual lipase is found in the mouths of infants, and that helps to digest fats, right? Lingual lipase for fats. For carbohydrate digestion, that is salivary amylase, and that is found in the mouth. Question 40. Bile joins the duodenum via the cystic duct, hepatic duct, common bile duct, cirrhotic duct, or none? So if you said C, common bile duct, that would be correct. Remember, the cystic duct is the two-way duct that connects the hepatic ducts, and the cystic duct can either send bile down to the duodenum, or the cystic duct can send it to the gallbladder. So for your test, you want to know that the hepatic ducts are one-way ducts that transport bile made in the liver. The cystic duct is the two-way duct that can send it up to the gallbladder or down to the duodenum. And the common bile duct connects the cystic duct to the duodenum. The cirrhotic duct is not, that's not a thing. It's not real. All right, question 41. The ligament that holds up the liver to the diaphragm is round, fenestrated, accessory, falciform, or none? So remember, we have those two ligaments, right? So our round and our falciform ligaments are the two ligaments that hold the liver. The falciform is the one that holds the liver to the diaphragm. The round holds the liver to the front and the back of the abdominal wall. So a way to think about it is maybe the fact that the round ligament is around, holding you around to the front and the back of the abdominal wall, whereas the falciform holds the liver to the diaphragm. Okay, so those are the two you need to know. Round holds the liver to the front and back. Falciform holds the liver up. 42, the enteroendocrine or G cells release which of these? So if you said A, gastric juice, that would be correct. The enteroendocrine or G cells are found in the stomach. They release the gastric juice. The gastric juice is the byproducts of the other stomach cells. So that'd be your chief zymogenic cells, your parietal cells, right? So your enteroendocrine or G cells are going to release that gastric juice, which is the product of the other cells. 43, zymogenic cells. All of these are true except. Right, so if you said D, release gastrin, that would be the correct answer, because the enteroendocrine or G cells are the ones that release the gastrin. Okay, so gastrin is released by the enteroendocrine or G cells, and that gastrin triggers the release of gastric juice. So again, gastrin, the release of gastrin would not come from zymogenic cells. It would come from the enteroendocrine or G cells. If you guys have not studied the enzymes, I would highly encourage you to study the enzymes. They are on the exam quite frequently. I think I counted on my exam, it was 10 questions on enzymes alone. So make sure you guys study that, okay? Question 44. Brush border enzymes. Which of these is not true about brush border enzymes? All right, so if you said A, you would be correct, because brush border enzymes are part of intestinal juice. Maltase and sucrase are two of the brush border enzymes, but amylase is the salivary amylase that comes from the mouth. Amylase is not one of the brush border enzymes, okay? Question 45, carboxypeptidase. Which of these is not true about carboxypeptidase? So carboxypeptidase, if you chose E, you would be right because all of those are true. So carboxypeptidase is a pancreatic enzyme. It is exocrine, which basically just means it's secreted. It is for carbohydrates and it is for protein digestion. So E, all would be the correct answer there. Okay, so I'm going to share with you guys I'll post it in an announcement, the Google Doc that I made with about 50 questions. If you guys haven't seen that, I did it the week before your spring break in SI. Again, it has like 50 questions I made in there, and I'll post that in announcements for you guys. Again, in your study resources module, which you all have access to, you have your lecture exam 2 practice questions, which will direct you to basically a themed version of each of them. So you have your articulations with answers, cartilage and bone, cardiovascular, respiratory, digestive, and answers. I think there's about 150 overall. And then like what you saw, you have access to the ones that I did today, as well as the answers, 30, and then another, I think it's like 50 that we just did. And then again, like I said, I have another 50 for you guys that I'll post. So that's like, what, 250 practice questions that you guys have available for you to prepare for the test on Thursday. I recommend going over all of your notes before Thursday, every detail. I would highly recommend doing all of the practice questions. Study with a friend. Remember Canvas inbox, you can always use that if you have any questions for me before the test. And if you guys have any questions for me, again, please don't leave. I'll be here until 6:45. If you don't have any questions, thank you guys for coming. I really appreciate it. And I'll see you guys on Friday morning for lab exam review, okay?
Thank you.
Thank you. Yes, I'll send more practice questions in an announcement. I just need to pull up my my Google Doc for that, and I'll get that posted for you guys.
I have a question.
Sure.
For the lab practical, I feel like I'm pretty set on like how to study for